It's my pleasure to share with you my experiences about complicated cataract surgery by using the new generation machine, the Centurion system. First, I would like to emphasize that each step in this slide is very important to the cataract surgery, even in patient selection and patient education. Today, I would like to focus on the traditional complicated phaco emulsification by using the Centurion system. The Centurion system contains three main features: active free discs, balanced energy, and applied integration. The first feature is active free discs. The new free disc management system, FMS, is designed to streamline the cataract surgery process. Compared to the traditional single peristaltic pump with only single fluid wave. The dual segment technology contains two complementary fluid waves, results in a more efficient and smoother flow during the surgery, and the aspiration tube becomes smaller, compared to the gravity-free discs with poor compensation. The active free discs provide dynamically detect and adjust irrigation pressure to compensate IOP loss. The most special, the soft BSS bag takes place the traditional BSS bottle. These features result in reducing post-occlusion surge, including time and volume displacement, even under high vacuum status. The second feature is balanced energy. Compared to the Kierman mini flare tip, the new balanced tip is designed to enhance cutting efficiency to increase emulsification effect from 130 microns to 192 microns. The new balanced tip can also reduce the chance of momentary thick occlusion and diminish the thermal effect. Active free discs and the balanced energy is designed to maintain surgeon-selected target IOP, and we can adjust the parameters to customize the surgical procedures. So, by the Centurion system, I consider it is safety for most of the surgeons to surgery in low IOP status, around 50 millimeter of mercury under medium vacuum settings, around 400 millimeter of mercury. When the surgeon is skilled, I consider 42 millimeter mercury IOP and 24 milliliter per minute aspiration rate can provide a very stable anterior chamber under very high vacuum up to 700 millimeter of mercury. And this is my ordinary settings in both phaco emulsification and IA. The third feature is applied integration. The Alcon's cataract refractive suite can connect several devices, including very own image-guided system, lens 6 femtosecond ascetic cataract surgery, Luxor surgical microscope, and Centurion phaco emulsification vision system. Next, I'm going to show you some videos. In the Infinity system, sometimes we can see post-occlusion surge in here. But in the Centurion system, the anterior chamber remains stable in the same step. No surge was noted. In the Infinity system, sometimes we can see an axial surge in occlusion break. But in the Centurion system, the anterior chamber remains very stable under very high vacuum, even in occlusion break. And in the Centurion system, despite the vacuum is approaching to 700 millimeter of mercury, we can see the anterior chamber still remains very stable. Okay, let's move on to see some challenging cases I have performed by using the Centurion system. This is a 65 years old male patient with grade 5 white nuclear sclerosis. I consider CCC is another key point in challenging cases. I use an ordinary capsulolysis forceps to perform the capsulolysis under variant guiding very carefully without staining the anterior capsule. I always use chop technique very carefully and make sure the nucleus is completely divided into 4 quadrants. Then I perform phaco emulsification under high vacuum, low IOP, low aspiration rate, and low phaco power to minimize the endothelium damage. We can see the anterior chamber depth remains very stable under very high vacuum status throughout the procedures, even in occlusion break. I complete we can see a well-centered and round enough CCC, and the CDE is only 9.9. In this case, I consider it's pretty good for a grade 5 nuclear sclerosis case. And this is a 58 years old female glaucoma patient for several years with small pupil. With my surgical experience, I didn't use the iris retractors in this case. CCC should be very careful to perform, since this is the only procedure that no any devices, including lenses, can help us in such small pupil case. I also use chop technique to chop the nucleus, avoiding the iris and the capsule very carefully. The following key point in such small pupil case is after engaging the quadrant by high vacuum, the phaco tip should be held in the pupil center when phaco the nucleus for the safety. I always fragment the nucleus by using high vacuum before using phaco power to keep low CDE as I can. We can see the anterior chamber still remains very stable under high vacuum throughout the procedures, even in such shallow anterior chamber depth cases. Peel of the cortex, also by high vacuum, very carefully. I complete the small pupil case smoothly and safely with very low CDE. The most important of all, I didn't use any assistive devices. The next case. This 52 years old male patient suffered from cornea penetrating injury about 20 years ago. Because of the pupil decentration, I used an IOL retractor to pull out the dialysis iris and perform a 5 mm capsulolysis under varion guiding very carefully. I also use chop technique to fragment the nucleus into 4 pieces. Then I perform high vacuum, low IOP, and low aspiration rate to phaco the nucleus as usual. On these cases, pay attention not to touch the iris when phaco the nucleus to prevent further damage. Also pay attention not to touch the iris and pull the capsule when peel off the cortex by high vacuum. The Centurion system provides a very stable anterior chamber depth during the surgery, and this is very important to the safety of these traumatic cases. After completing the phaco emulsification, as we can see, the CDE is 0 in this case. And we can see the CCC margin from this hole was pretty matched to a 5 mm varion CCC marker here. That means the IOL was centered and enclosed in the capsule bag. This patient achieved an amazing result at the first day post-operation. The UCVA was 0.9. This 65-year-old male patient living in the country of the South Taiwan has suffered from blurred vision for several years, but he had been rejected for the cataract surgery by many doctors before he came to my clinic. Some doctors told him that his eye was hopeless, so it was not worthy to do the cataract surgery. The other doctors told him that his cataract was still incipient, so it was no need to do the cataract surgery. With my surgical skill and the Centurion system providing stable active fluidics and powerful balanced energy, I complete the surgery smoothly and safely with minimal CDE. And the patient was very happy after the surgery. The UCVA was 0.5 at the first day post-operation. And the last case is a 52-year-old myopic astigmatism male patient. And his cataract was just only grade 2 to grade 3 nuclear sclerosis. So it is not so complicated in surgical scale, but it's in the patient's high expectation. The patient requests to treat his cataract, his high astigmatism, and treat his myopia and presbyopia within 5 days, because he said he is very, very busy. Since he told me that the money is not a problem, so we use the varion and lenses with accurate incision to correction about 1 diopter astigmatism. Then we use Centurion under Luxor microscope. Lastly, we use AutoSert to insert the toric restore to correct the other 2 diopter. At the first day post-operation, the UCVA was 20/20. The patient was very happy, and he received the fellow eye surgery at the same day. And this is my surgical team and consulting team. Without them, the good result is not possible. I can't be too grateful to them. And most of all, thank you very much for your attention.